Hello, my name's Helen Skiffington, and I'm from London in the UK. And I'm with my colleague Ciara Breen, who is from Galway, Ireland. We're both occupational therapists specialising in neuro rehab, and we recently wrote a paper called More Than Brain Fog: Cognitive Dysfunction and the Role of Occupational Therapy in Long COVID. We really wanted to write this paper because we wanted to increase awareness of the cognitive issues that people with long COVID experience, mainly because these are frequently reported by people with long COVID and they have a real impact on their daily life and including work and also their meaningful roles. So, if, for example, being a parent, being an employee, and things like that. So it's very much related to the role of occupational therapy. And we had noticed there was quite a gap in the literature on both of these topics. And actually, the cognitive dysfunction in long COVID is often sort of minimized and brushed off as brain fog. So we wanted to sort of write a paper that sort of brought it all together, and sort of emphasized the fact that there are real mechanisms that are potentially contributing to this that are serious, and it's more than brain fog, and the effect on the person's life is more than a bit of brain fog and is incredibly disabling. We also wanted to make sure that we mentioned myalgic encephalomyelitis and chronic fatigue syndrome, MECFS, and sort of learn from them. We're not reinventing the wheel. We wanted to learn from things that people with those conditions have experienced, and one of them being post-exertional malaise and post-exertional symptom exacerbation. So that's the worsening of symptoms with increasing activity. And one thing, again, we had noticed that with that, there seems to be a lot of focus on physical activity and exercise. But it's also important to remember that cognitive exertion can also lead to that increase in symptoms. And it's much harder to sort of understand and also pace because we use cognitive energy all the time. Just having a conversation is using cognitive energy. So that also leads to how debilitating the whole condition is, but definitely the cognitive element, which is so often misunderstood and not spoken about. We sort of looked through the literature and tried to put forward potential mechanisms that are contributing towards the cognitive difficulties that people with long COVID experience. And they included neuroinflammation. So there's lots of studies showing sort of autopsy studies that have showed inflammation within the brain after COVID. Another mechanism is viral persistence. There's plenty of research showing how the virus can persist in the body for long periods of time, even years after infection. We also mentioned structural changes within the brain. So there is research showing lots of changes in the brain, including reduction in brain size and grey matter, which could be contributing to these symptoms. And also the vascular damage, so like endothelial damage and clotting. And then which sort of leading to a cerebral hyperperfusion. So obviously the brain needs an adequate blood supply, rich with all the things it needs to function. And if it's not getting that properly and effectively, then it's going to overwork, and that can lead to fatigue and the cognitive symptoms that people experience. And then also autonomic dysfunction. So lots of people with long COVID experience difficulties with their autonomic nervous system not working as it should. And many of them have postural orthostatic tachycardia syndrome, so POTS, and orthostatic intolerance. So they're not having enough blood going to the brain when they're upright. And obviously, we need adequate blood supply to the brain to function. So those are the sort of mechanisms that we spoke about alongside PEN and PESE. And then we sort of went into the recommendations for clinical practice, which Ciara is going to speak about.
So the first area that we looked at was the assessment approach that an occupational therapist, or indeed other professionals, may also find this approach useful as well, such as neuropsychologists or speech and language therapy pathologists may also find a similar approach to be useful. So within the cognitive assessment, because of the fluctuating and episodic nature of the cognitive impairment that people experience with long COVID, the assessment approach needs to meet that and to kind of take account for that. So we propose triangulation between the types of standardized assessments that we would very typically use in practice, together with a very detailed history, working very collaboratively with the person with long COVID to uncover the particular challenges that the cognitive dysfunction display is manifest in their lives. So, for example, that might be the pattern of cognitive impairment that they experience, or it might be looking at specific areas of occupational performance, such as work, such as college, such as conversations, for example. And then finally, the third element that we would propose for assessment is patient-reported outcome measures. So it's really important, and it feeds into the, I suppose, dismissal that we've mentioned, and that we certainly hear a lot from our colleagues and from people with long COVID, is that very often, if that initial standardized assessment doesn't show cognitive impairment, there's a risk that the person may be dismissed. And so we really feel that it's important that there is a full rounded picture, and to summarize again, that's history, standardized assessment, and patient-reported outcome measures to really gather a rich and detailed picture of cognitive dysfunction as it manifests for that individual. And then moving on to intervention, I suppose really as occupational therapists, of course, we're highly skilled in in addressing occupational performance across a whole range of areas of daily living. From school, as I mentioned, through to meal preparation, through to driving, a whole host of things. And as Helen has said, the impact of cognitive dysfunction is hugely pervasive, because we need cognition for every small element of our day-to-day life. So the intervention really looks at a number of different things, of course, bespoke to the individual, as all occupational therapy is, but particularly we feel an emphasis around cognitive pacing and education around how pacing and how other energy management techniques might look in the context of cognition. So this might look at time use, particularly helping someone to pace to avoid post-exertional malaise. Looking at tempo, so looking at kind of whether we can adjust the tempo of tasks, particularly when we're thinking about people with challenges in their information processing speed, for example. Adjustment of tempo can be the difference between success and failure in a task. And finally, thinking about temporality. So looking at the influence of various things such as time of day, time of month, time of year, emotional triggers, and all of those various other elements that kind of, conceptually kind of help the person to kind of look at their activities in relation to their time, and to really use those skills to then improve their occupational performance, and to sustain it in a way that's manageable without triggering post-exertional malaise. We also, in our paper, discussed some specific cognitive scaffolds and strategies. These would be compensatory techniques to help the person and to support them in functioning, and to also reduce the energy demands of a cognitive task. And finally, we looked at kind of some specific adaptations as well that might be useful for people around postural adaptations and autonomic issues as well. So thank you so much for listening to our video abstract. If you have any questions or comments, please feel free to reach out to Helen and I. We'd be delighted to hear from you. And thank you so much for listening today.